Hello friends, today we will discuss about visual pathway. It is very important topic in the section of special senses in the subject physiology, okay, and can be a 5 marks question. So, this is a diagram from the Guyton, textbook of Guyton. You can see this is the left eye, this is the right eye, how the information from the retina of the left and the right eye ultimately goes to the visual cortex, that is the occipital lobe, okay, and these are the bundle of the nerve fibers, that are the axons, which are originating from the retina, that is the ganglion cell layer. So, from the rods and cones, then bipolar cells, then the ganglion cells layer, the optic nerve originates and it will go posteriorly, and ultimately the visual sense, it is sensed in the occipital lobe, it is known as visual cortex. Okay. So, let us draw a line diagram of this visual pathway. It can be a 5 marks important question in the university theory exams. So, we will study this with the help of one simple line diagram, how exactly the image which is formed in the retina is transmitted to the occipital cortex, that is nothing but the visual pathway. First, let me draw the visual fields. Visual field is the portion of the external world which is visible to the one eye when the gaze is fixed to a particular fixation point. Now, consider this as a visual field of the left eye and consider this as the visual field of the right eye. That is the portion of the external world when the, suppose when we close our left eye, whatever which is visible on the to the right eye, that is the area of the external world, that is known as field of vision of the right eye, left eye. Okay. Now, I will draw the left eyeball and a right eyeball, a rough line diagram of the left eyeball and the right eyeball. Okay. So, let me draw it neatly once again, left and right eyeball. Okay. Try to draw a circle. Okay. This is the left eyeball, similarly one more here. So, this is right eyeball. Okay. Now, this is the left side of the left visual field, this is the right side of the left visual field. So, we divide the visual field into two halves, left side and right side. You can also say is that this is the nasal, suppose there is a nose here. So, nasal part of the left visual field and the temporal part of the left visual field. Here, this is the nasal part of the right visual field and this is the temporal part of the right visual field. Okay. Now, this is the right and the left eye, this is the left eye, this is the right eye. Okay. Now, let us draw the optic nerve. So, from the ganglion cell layers, the axons will go posteriorly and they form the optic nerve. So, what I am drawing is just a part of a optic nerve. Now, this optic nerve runs posteriorly from both the eyeballs, right and left, and they will run medially and ultimately they will meet at a junction, and that particular junction it is known as optic chiasma. Optic chiasma. Optic chiasma is a part of this where the two optic nerves, that is right and left optic nerve, this is the optic nerve, will unite. Okay. Optic nerve. Now, let us draw the innermost layer of the eyeball, that is the retina, posterior most part. Okay. Now, I am drawing it half of the retina. This is the left eye, in that this is the right side of the left eye retina. This is the red, with the red color what I am drawing is the hemiretina, it is the half retina. Similarly, here also I will draw the half retina on the right side. Okay. Half retina. Now, I will draw the other half of the retina with blue color. Okay. So, left side of the left retina with this blue color and the left side of the right eye retina with this blue color. Okay. Now, together actually this is retina, just I am drawing it to mark the demarcation. Okay. This is the left retina and right retina. Okay. Right part of the retina. Okay. Now, consider this half, that is hemiretina or the nasal hemiretina of the left eye. So, the fibers from this, from the, that is ganglion cell layers, you know there are 10 layers of the retina, and from that ganglion cell layer the axons will run posteriorly which form the optic nerve. They will go posteriorly and medially and they will cross to the opposite side, they will cross to the opposite side. Remember, this sense of vision is also a crossed vision, is a cross sensation like pain and temperature pathway, which is going to the opposite side. Okay. And finally, they will terminate into one structure. That structure, it is known as lateral geniculate body. What it is known as? Lateral geniculate body. On both the sides this structure will be there, and it is known as lateral geniculate body. Okay. It is a part of thalamus. It is a part of thalamus, you know, thalamus, hypothalamus. Okay. We will discuss in detail about that structures later. Right now it is just, you remember, this is a part of thalamus. Okay. Now, lateral geniculate body. So, this green color structure, lateral geniculate body, it is also known as dorsal lateral geniculate nucleus. So, there are many nucleus in the thalamus. So, one such nucleus is this lateral geniculate body. Okay. It is a part of thalamus. Now, see, similarly, this part of the right eye, that is the half portion of the right eye hemiretina, the fibers or the axons which are originating will go posteriorly. Now, interestingly, it will not cross to the opposite side, it will go on the same side lateral geniculate body. Okay. Same side lateral geniculate body and terminate here. Now, again there is a interesting fact here, let me explain that thing. So, consider this as the lateral geniculate body. Lateral geniculate body, it is basically having 6 layers. Okay, 6 layers lateral geniculate body. Okay. So, what are that 6 layers? Let me write here 1, 2, 3, 4, 5, 6. Okay, 6 layers are there. Now, from the left eye, whatever fibers are coming like this, these fibers which are crossing and coming to the opposite eye from the left eye, it will cross and it will terminate in the layer number 1, 4 and 6. Okay, layer number 1, 4 and 6 ultimately. Now, from the right eye, the fibers which are not crossing and terminating on the same lateral geniculate body, they will terminate in the layer number 2, 3 and 5. Okay. So, let me write here. So, this will terminate in the layer number 1, 4 and 6, that is opposite side, and on the same side in the layer number 2, 3 and 5. Okay. Hope this is very much clear how the nerve fibers which are coming, that is this optic nerve fibers which are crossing through the optic chiasma. Now, after crossing this optic chiasma, this structure, it is known as optic tract. What it is known as? Optic tract. Okay. It will pass through the optic tract and finally terminate into the lateral geniculate body. Okay. Now, consider the other half of the retina which I have marked with the blue color. Now, this hemiretina, it is the temporal side of the left eye, this will go back, the fibers will go back into the optic nerve and it will not cross to the opposite side and it will terminate in the lateral geniculate body layer number 2, 3, 5 here. Okay, 2, 3, 5. Similarly, this one, this half hemiretina, it is the nasal side of the right eye hemiretina. The fibers will go and it will crosses to the opposite side and it will terminate into the layer number 1, 4, 6 of the lateral geniculate body. Okay, hope it is very much clear. Now, after this from this lateral geniculate body, it will, the fibers will terminate into finally into occipital lobe or the occipital cortex. It will terminate into occipital lobe or the occipital cortex. Okay. And that area of the occipital lobe, it is known as area number 17, or it is also known as primary visual area or primary visual cortex, primary visual area or primary visual cortex. Okay. Area number 17. Sometimes it can, again there is the area that is known as area number 18, that is known as secondary visual area. This is secondary visual area in the occipital lobe. It lies in the calcarine fissure, okay, medial side of the occipital lobe. Now, some fibers from this lateral geniculate body, they will go or pass through the parietal lobe and finally terminate into the this area number 17, that is the occipital cortex through the parietal lobe, okay, and few fibers will go through the temporal lobe, that is known as inferior fibers, and ultimately they also terminate into the occipital lobe, area number 17. These are the inferior fibers, okay. Similarly, on this side also, that is on the right side, some superior fibers will go and terminate here while passing through the parietal lobe, and inferior fibers will go, they form a loop here and they will terminate into the occipital cortex, that is the area number 17. Now, this superior or inferior, this together they are termed as optic radiation. What they are termed as? Optic radiation. These fibers basically they are the axons, okay, nervous tissue, optic radiations. It is also known as geniculocalcarean tract. It is also known as geniculocalcarean tract. Why it is known as geniculocalcarean tract? Because it starts from the geniculoid, lateral geniculate body, and ultimately end into the calcarine part, that is near the calcarine fissure of the occipital lobe. So, it is also known as geniculocalcarine tract, and finally it will be ended into the visual cortex or the primary visual area. Now, it has started from the retina, okay, it has started from the retina, it is the inner layer, and ultimately ends in the occipital cortex. Now, these structures constitute the visual pathway. Let me highlight that. First is the retina, second is the optic nerve, third is the optic chiasma, fourth is the optic tract, fifth is the lateral geniculate body, sixth is the optic radiation, and seventh is the visual cortex or the primary visual area. Now, these 7 structures is known as simply visual pathway. So, visual pathway starts from retina, ganglion cell layer, then optic nerve, optic chiasma, optic tract, lateral geniculate body, optic radiation, and primary visual cortex. Okay. Same thing we will just see once again from the diagram of the textbook. See, this is the retina, then it will pass through the optic nerve. So, here nasal fibers will go to the opposite side, temporal fibers will not cross, and they will, this crossing over takes place at the level of the optic chiasma, and after optic chiasma this bundle of fibers known as optic tract, then they will ultimately terminate into the lateral geniculate body, and this from lateral geniculate body through the optic radiation, it is also known as geniculocalcarean tract, they will terminate into the occipital cortex, that is the visual cortex, that is it is near the medial side, that is the calcarine, near the calcarine fissure. Now, from this lateral geniculate body, few fibers goes to the midbrain also in the superior colliculus in the pretectal area, okay, 10% of the fibers, and remaining 90% goes to the optic radiation. We will discuss this under the light reflex. Okay. Right now, visual pathway, just concentrate here how this will go. Okay. Now, what happens if there is a damage here, damage in the visual pathway system, any lesions, that is the lesions of the visual pathway. Lesions means damage, lesions. If there is a trauma or lesions in the visual pathway, what will happen? Okay. Let us see one by one. So, first just imagine on this left optic nerve there is a damage or lesions, it is cut or some disease or trauma, whatever it may be, due to something, this is known as lesion number A. So, if there is a lesion here, lesion number A, so you can consider this as the left visual field and this is as the right visual field. Visual field is this one. This one is the left visual field and this one is the right visual field. Now, one more interesting fact here you are supposed to know is, see, from this left visual field, that is the area of the external world which is visible to this left eye. So, this left part, the light rays will come and converge on the right part of the retina, and the similarly here also the left part of the visual field, the light rays will come and converge on the right part of the retina. Similarly, the right part of the visual field will go and terminate into the left part of the visual field, that is the image, the light rays, here also same thing, it will go to the opposite side. Okay. So, the right side of the visual field, that is the external world, the light rays will go and terminate into the left part of the retina, and similarly left part will terminate into right part. Not only that, the superior part of the visual field will go and terminate into the inferior part of the retina, and the inferior part the image light rays will go and terminate in the superior part of the retina. Okay. Now, what happens if there is a damage here? So, what will happen to the visual field? So, here left sided will be totally blind. So, left side will be totally blind, that is left eye a person can't see anything if there is a damage to the left optic nerve, and right side image will be normal, that is you can see the normal, that is the visual field will be normal. This is a visual field defects. Okay. Now, consider another lesion, we will mark it as B, that B lesion will be here at the level of the optic chiasma centrally, at the level of the optic chiasma centrally. If this is, if there is a damage here, generally it occurs due to the pituitary tumors, okay, because this is near the sella turcica. So, when the pituitary tumors expand and they protrude outwards, upwards, so they may compress this optic chiasma and it may cause some visual field defect. So, typically this visual field defect, it is called as bitemporal hemianopia. Bitemporal, this complete blindness, it is called as anopia, anopia, or it is also known as anopsia. Okay. Both are same, anopia or anopsia, that is the blindness. Now, here this is half of the visual field is affected. Now, it is called as bitemporal hemianopia, bitemporal hemianopia, okay, half side. Okay. Now, consider one more lesion. Suppose on the left optic tract there is certain disease or lesions or damage, section number C. Okay. Section number C. Now, how does the visual field will look? So, remember as I said you, it is a cross sensation. If the left eyeball, left part of the visual field is affected, means right side visual field is lost like this. So, it is called as right sided hemianopia, homonymous, it is heteronymous, it is homonymous hemianopia or anopsia, or anopsia. Okay. It is the defect in the optic tract, left optic tract. Okay. Now, similarly, if there is a defect here, if there is a defect in the this one optic radiation superior part, we will mark it as option lesion number D, optic radiation superior part, Now, what will happen to the visual field? So, we will draw the 4 quadrants. So, you can see if there is a damage on the left side, means the right sided visual field will be affected, because it is a cross sensation, right sided visual field will be affected, and if it is damage to the superior layers, means inferior part will be affected. So, right sided inferior defect will be seen, right sided inferior defect will be seen in the superior optic radiations. Similarly, we will mark one more lesion. If there is a lesion here of the E, lesion number E, this is lesion number E on the inferior optic radiation, then same thing, right sided visual field, quadrantanopia, but the superior part is affected, visual field. Okay. So, this is the optic radiation, and finally, if the lesion is on the posterior most part near this visual cortex here, that is the F lesion, that is near the primary visual area just before that, then what will happen? So, there will be right sided hemianopia, with macular sparing. So, this posterior most part here in the visual field is usually by the macula. So, this part is usually the area number 17, it is the macula part, that is it represents the macula of the retina. There is a point to point representation of the retina in the lateral geniculate body as well as in the visual cortex. Okay. Then this other parts is for the peripheral part of the retina. So, this macula this part, posterior most part, will have dual blood supply. Okay. So, generally this part damage is spared if at all, if there is obstruction of any one of the blood vessels. So, it is a site of highest visual acuity. So, there will be sparing of the central vision, okay, that is the macular sparing, and rest will be affected. Okay. Now, let us see the diagrammatic representation of a textbooks effect of lesions. I will just highlight the main thing which I have discussed. This is the optic nerve, first lesion, optic nerve, left optic nerve. So, left sided visual field, right sided. So, complete blindness in the left eye, left visual field. Okay. Then this one third is optic chiasma, usually by the pituitary tumors, pituitary tumor generally, commonly. Okay. Pituitary tumors, bitemporal hemianopia, optic chiasma, usually asked in MCQs. Okay. Bitemporal hemianopia. This 5 and 6 is the optic tract lesions. This 7 and 8 we have discussed again in the optic radiations, superior and inferior part. This inferior part, it is to the temporal lobe fibers, and this is parietal lobe fiber, superior part. So, opposite quadrantanopia is seen. Then this ninth part is the lesions here in the visual cortex. Okay. With and 10th part, just now what I have explained you, just near this posterior most part with the macular sparing. So, this is all about the visual pathway and the its lesions. Okay. Hope you like our video. So, please subscribe our channel Doctor's Corner and share the link with your friends. Thank you.